MGH has a long-standing history in disaster relief and going abroad to assist people during times of need. I'll focus on the last 10-15 years, starting with 9/11 with Sue Briggs and her IMSR team. They were first on the spot there and to assist in first responders for 9/11. Well, we were involved in Katrina, we were involved in the tsunami, in both those, and in the last Haiti effort we were with the Navy as a partner with Project Hope and the USNS Comfort. So we've been a group of people, a group of doctors and nurses, pharmacists, clinicians who have responded to international disaster.
The path to creating the MGH Center for Global Health has been an important and interesting journey. I would say a lot of this began with our response to human tragedy. Within hours of the attack on the World Trade Center on September 11th, the earthquakes that hit Iran and Haiti, and the incredible tsunami that devastated Indonesia, MGH clinicians responded.
Well, one of the unique features of our international team that is very important is that we truly are a multidisciplinary team. We don't judge what we're going to see. We come fully equipped to take care of the full spectrum. If there's no surgery, then the surgeons help delivering babies. And we saw over 3,000 people and did over 300 operations in our field hospital in the first month. But everybody is multitask. I've played pharmacist, I have cleaned up trash, I have helped the obstetrical people do emergency cesarean section.
My supervisor sent an email saying that, they're looking for a volunteer to help with the devastation in Haiti, and I was the first one to put my name on the top of the list. And he told me, I'll put a word for you, I think, because you know the language and you're gonna have first priority. And I put my name in 2 weeks later, and my boss called me and told me on a Monday, he said that I'll give you a short notice, you have to leave tomorrow. I said, if you give me 3 hours, I'll leave. And then I packed my bag and leave, and this is a good opportunity for me to help my country, because without this hospital, I wouldn't be able to do it. I don't even know that Project Hope existed until my job connected me with them.
When I first arrived on the Comfort is a very large naval ship that has somewhere between 800 and 1,000 beds and about 12 ORs. Has a crew of about 1,500 and about 300 mariners. The ship was actually an empty hull, if you will, prior to this, and so the first day we did nothing but load, and load meant taking crates of food, crates of equipment, and just throwing them on board. The idea was to leave as quickly as possible and get down to Haiti, so it was chaos and confusion, but organized chaos and confusion.
We ended up going to a hospital that was about an hour outside of Port-au-Prince in St. Mark with an NGO called Partners in Health. We had a team of surgeons, general physicians, nurses, and while we were out there we took care of about 250 patients. My role in the disaster was really overall management. Managing kind of the flow of patients, managing the nursing staff and where they would be in the different sections of the hospital to make sure that we had every section covered and that all of our patients were getting the same level of care.
One of my most memorable experiences was evacuating patients off the palace grounds. The palace is a beautiful grounds and also a beautiful place. It suffered badly during the earthquake. We had to use it for evacuation, and the tent cities that set up outside Port-au-Prince or outside the palace were all around. But the people were extremely respectful in that area, as if it were sacred ground, I think partially because of the country's inheritance and the country tradition. So during all this time where chaos and food and water and all kinds of needs were occurring, people were extremely gentle, careful, respectful of the evacuation that was going on, and I think of the palace grounds themselves.
We've been talking about putting together, really succinct training programs for our volunteers to ensure that they are even more qualified to work in these specific types of environments when they respond to emergencies or even when they're working in development work. So making sure that people know about what are the humanitarian principles that are involved in working in these types of things. What are the ethics in working in a country that's not your own? And making sure that we are the most qualified to respond to these type of emergencies and also when we are called to do development work as well.
The most memorable things that I can remember about my collaboration with my MGH coworkers at the Navy ship is when everybody get together to help the patient. And that's the most memorable thing that I remember. The coordination, they help, for example, when I don't have any CT to do, I help them with the translation. If there is some patient, even on the ground, that needs some medication, I can coordinate with the doctors to provide a prescription for those patients to have those medications.
And one of my most memorable experiences was we had a whole tent of people with severe injuries who had no family. And they wouldn't talk and they wouldn't smile. And we found out that one of the people could sing. And we brought him into the tent and he started singing, and it was better than any pain medicine. Suddenly, all of these people who had lost their family, had no one there, started singing with them. Music is such a part of the Haitian culture. And we started that, and then the minister arranged for a team to come in every day. And seeing the smiles on their face was better than anything else. We can't change the devastation or the misery, but we can at least give them hope for the future.